Miss, how you doing, darling?
I'm doing good. How are you?
I'm doing pretty darn well. Just up here in good old Charlotte, North Carolina, trucking along as always. So the rambling
Trucking
man.
along. Well, we're in Houston. We are in Houston getting pounded by rain. So hopefully April's showers bring May flowers and probably lots of mosquitoes. But I'm so tired of the cold weather. I'm ready to be hot and sweat. So
Yeah, I know. Let's go. I know. I'm fixing to make a trip out there to see y'all in Houston, or y'all coming to the South. So it's been long overdue for sure, sis. You know what
long
I mean?
overdue, my friend. Let's do
I
it.
know. We'll make it up. So, well, y'all, let's get into it. So today we're going to be talking about the hidden game changer. Why ultrasound is becoming non-negotiable in aesthetic injecting. So whether it be safety, precision, uh, liability, because today's aesthetic landscape, choosing not to use the ultrasound, it isn't just a preference. It can become a risk. Correct, Miss?
Yes. I mean, today we're talking about something that I feel very strongly about. And honestly, it's something that's going to change the entire standard of care and aesthetics, in my opinion, for sure.
What's crazy about it? It's that it's already here. It's just not widely adopted yet.
Exactly. We're talking about ultrasound, and it's not in a fluffy surface, foo foo kind of way, but we're talking about what matters in safety, precision, and honestly, a really big liability in aesthetics.
Yeah, because I mean, this isn't just about getting pretty results. This is about protecting your patients and protecting yourself truly as a provider.
Absolutely. And for those that are listening to this episode might completely change the way that you look for an injector, quite honestly. So, let's start out simple. Ultrasound and aesthetics allows us to see underneath the skin in real time things that we cannot see with the naked eye. And so it helps us visualize blood vessels, filler placement, tissue planes, and honestly identify complications, whether they're, certain things like occlusions, nodules, migration. I mean, the list goes really on and on, Wyatt.
Yeah, because it's like literally, turning the lights on. Because without it, we're in still many ways. You're working blind pretty much.
No, absolutely. And this is where ultrasound changes everything. Injecting goes from educated guessing to really precision medicine. So, without ultrasound, we're relying on anatomical landmarks. And having been a trainer for many, many years in the aesthetic space, anatomy is just a template. And so although everyone has, the same anatomy, sometimes the placement of that anatomy varies. And so I think this is why ultrasound is necessary because without it, we're relying on anatomical landmarks and we're relying on what we're feeling with our hands and what we're seeing with our eyes, but we're assuming depth and we're assuming placement when we're not using ultrasound. So with ultrasound, we can confirm, exact depth, be extremely precise with placement, and we can see that product placement or removal in real time. And it can allow us to avoid those critical structures, which we quite frankly don't want to run into when we're using injectables, biologics, anything like that, for sure.
Well, no, and I'm sure, like, we can elaborate on this more too. As I'm sure you see this all the time, but like, so the second you actually see it in real time, you realize how much guesswork there still, is without it. Correct?
No, absolutely. I mean, let's be honest. Patients are paying for precision and not probability. And so what that means is I without being precise, I might need 6 syringes, but if I'm very precise with my procedure, I might need 3 syringes, right? So what that does for the patient, it is allows them to get really good results without overcorrection and guessing where we're placing the product. And what that does for patients over time is it keeps them looking refreshed and normal. But what really the bigger message here is precision is so key in making these procedures safe.
Well,
So, let's talk about what really matters, right?
and I just wanted to ask you a question too, real quick on this too, and not to sidetrack, but like you talk about, do you have patients coming in maybe say I just need 1 cc, or I just think I need 2 cc's, or whatever like that? This is probably where this really comes into effect too, to help them to where they just think they need that 1 cc, but then they might come back in a month and they're like, I'm not happy with my results. Does
Absolutely. And I try to talk to patients in my office in kind of real terms, right? And so one syringe of a dermal filler is the equivalent of a blueberry, the size of a blueberry, or a fifth of a teaspoon. So just even with using ultrasound, precision is super important because the amount that, myself as a provider or the artist painting this canvas, if I have an unlimited amount of paint, it doesn't necessarily mean it's going to turn out as if I have just the appropriate amount of paint, but I know exactly where to put it on the canvas, right? And so precision makes it less expensive in the short term and the long term for the patient. But as a provider, it helps me get exactly the results that I've promised my patients, and spend a hell of a lot less money when we know exactly where we're putting it. So, ultrasound improves safety by identifying those vessels before we inject, avoiding high risk areas in real time, confirming safe planes of injection, and detecting early complications if there were to be one. So, that real world impact means we reduce the risk of intravascular occlusion. We can identify more quickly complications, and this builds better patient trust. And having a true plan before you poke approach is super important. And so, for example, in my practice, patients come in all the time for under eye filler. And about 1 in 50 of those patients is actually a good candidate. And so before we ever touch a patient and put anything under the eyes, we use our ultrasound to see what we're seeing. So, because if it's fluid buildup or lymphatics, we would never use a dermal filler under the eye because it's going to exacerbate that problem and actually make
Mhm.
it worse. And sometimes the only reversal is to have it surgically removed. But if we do an ultrasound, which takes about a minute and 30 seconds, we can very quickly identify if it's fat, if it's fluid, if it's bone, or if it's ill placed filler, right? And so just by using that simple tool, we really understand what we're seeing, and it makes us safer injectors to know exactly what we're seeing instead of guessing.
Yeah, so and those are all things you just spoke about. Like you said, you're with ultrasound, you're confirming the depth, you are seeing the product placement in that real time. You are, like you said, avoiding those critical structures. And so this is like, the difference between like throwing a throwing a dart in the dark, right? Or versus turning on a spotlight, right?
100%. That's exactly right. So, um, you know, that's what makes ultrasound super important. And I hope that in the future, it becomes kind of the gold standard in this
Hmm.
industry. We really don't need to, you know, give someone, you don't give someone a driver's license, put them in the car, and let them go down the freeway without having a seatbelt on. It just doesn't make a lot of sense. So, to be safe, injectors, I think, we have to have an ultrasound, but you're going to think I'm crazy with what I'm about to say. You can have an ultrasound device and not know how to use it, right? And it looks pretty in the corner, and occasionally you dust it off when it should be one of the first things that you're doing when a patient comes in for a filler consultation, especially if they said they've had filler in the past. I like to know what I'm looking at. And I am, consider myself a damn good injector, but you're only as good as what you can see. And so we tend to use, you know, the ultrasound on almost every patient because it's just super important to be precise and just to get it right the first time. And honestly, because we are, get this, one of the few offices in Houston, which is the fourth largest city in the United States. So we have a huge aesthetic market here. Most practices do not have ultrasound. And so we get a ton of referrals on a group text with a bunch of injectors all over Houston. I'm not even sure how many thousands of people are in that network. But when there is a complication with dermal filler, we are one of the first people that are referred, to our practice, because we have an ultrasound, number one, and number two, we actually know how to use it. So, when physicians and nurses and nurse practitioners get in a bind, we typically will do, the professional courtesy of getting them out of a bind by helping, with their adverse events that they're hopefully that they're seeing but not seeing in their practices, if that makes sense. Sorry, I digress.
No, I mean that definitely that makes sense. That's kind of along the lines of what I said kind of before, like folks that are having to come back in and kind of recorrect maybe things that have happened in the past. And once you understand what's at stake, it's hard to justify not using it.
1000%, Wyatt. This is one of the most overlooked benefits of ultrasound is using it to dissolve filler. So
Hmm.
I always say, having ultrasound is your insurance policy. And we all know that we have to have malpractice insurance and insurance on our buildings, but we should have to have some sort of insurance on our craft. And so this just really is the what makes injectors way more safe is when they are using and utilizing an ultrasound with every patient. So, um, you know,
Like
um,
without ultrasound, then like what? Like without ultrasound.
well, I think, I see patients that have had multiple sessions of hyaluronidase to dissolve filler unsuccessfully, because there's no precision there. They're guessing. And your tissue is divided into many planes and subplanes. So, you can't just put a needle in and guess where the filler might be. I guess that's what's really intriguing to me, is to try to guess, to hit the target. And we know that when you don't use ultrasound when dissolving filler, that you can over dissolve, and sometimes that's not the
Hmm.
goal. And it takes multiple sessions. And hyaluronidase is expensive. I mean, for I think it's 2 cc's, it's $400. It's not a cheap product,
Hmm.
and you have to stock, you know, many. I think we have probably 20 vials of Hylenex on hand at all times because we do so much injecting. And
Yeah.
so, you just want to make sure that you can, you're not having to have those multiple sessions by doing blind injections. And patients, unfortunately, by the time I see patients to get filler dissolved, they're one word, and that is frustrated.
Hmm. Yep. I completely agree. And like, if you it can feel like you're chasing something that you really can't see, right? But then when we're using
Right,
ultrasound, right?
right.
We
Like, absolutely. You have to locate exact filler pockets. You have to be able to differentiate filler versus tissue and target only what needs to be dissolved. And so when I do trainings with other practitioners, I always take a poll of how many people in the room have an ultrasound. At my last training that I did, um, there was 32 injectors present for the training,
awesome.
and 8 of them had ultrasound, and 6 of them had never even used it because they didn't have training on how to use it. And that's devastating, quite frankly. So
Well, I mean,
that's,
and
that's
well,
just
yeah. And I was asking you too. I mean, were they aware of that too?
I mean,
Is
that
it?
just turns
Yeah.
this just turns dissolving filler into precision medicine instead of trial and error. And so, if you have an ultrasound and you're a master at your craft using the ultrasound, you get faster correction, less product needed, better outcomes, increased patient confidence. And, by using the tools in your practice, it decreases your liability as a provider to know that you've done all the things. And now here's the part that honestly shocks most people. Get this, Wyatt.
I
If
got you.
you don't have a tequila, you should probably get one. All right, ready? So
I'm ready. I'm always
less
ready.
than less than 15 less than 10 to 15% of med spas use ultrasound on a regular basis. And drum roll, even fewer use it for complication management and dissolving filler. That is
So,
like
so you're telling me
mind blowing to me.
you're telling me the majority of injectors are still pretty much injecting blind.
And patients assume that that is the standard of care, and it absolutely should not be. I mean, let's talk about liability, right? Because this is where things get very real very quickly. So, the shift that is happening in aesthetics medicine is that number one, patients are becoming more educated, which is awesome, in my
Hmm.
opinion.
Yep.
And now, because we have access to, Facebook, Instagram, TikTok, all these outlets, right? Some are real, some are fake. However, um, complications are more visible. I mean, with social media, and you can see every litigation, you can see people talking about their bad outcomes. People expect more, and so I think the standard of care is evolving, but we're just not there yet.
The risk with ultrasound, or without, I should say, without ultrasound, is, higher chance of complications, right? So we have that. We have harder to defend the outcomes. Increased legal exposure, of course, and then now going the risk without using, or with using, I should say, with using ultrasound. Now you have documented visualization. You have evidence of precaution, and you have a higher standard of care, which is all huge, I believe.
Absolutely. And this isn't about just being a better injector. This is about protecting your license, your practice, your reputation, and quite frankly, having to deal and live with the fact if you cause something to happen and you haven't used every tool that you have in your tool shed is just devastating. And so, I think people consider some barriers to having ultrasound as cost. And I
Hmm.
always say this: if you cannot afford an ultrasound, whether it's $3,000 or $20,000, you shouldn't be injecting.
Okay.
Period. In my opinion, that should be the first device that you purchase as a new provider. You have your injectables, and then you have an ultrasound. From there, you can bring on whatever you want, but your insurance policy is going to be your ultrasound device. And unfortunately, having been in this space for so long, this is actually something that A is never purchased, B is only purchased after a catastrophic event, or C, they purchase it to say they own it and they have no idea how to use it. It's just mind blowing, really. And so, yeah.
Yeah, so it's a lack, like you were saying, lack of awareness. But here the real question is, though, like, what's the cost of not having it?
Absolutely. Wyatt. One complication can cost way more money than the device itself. And so, my hope is that ultrasound will hopefully become the standard of care in aesthetic medicine when dealing with injectables, but even energy based devices as well. Patients will start asking for it. So, they will come in when they're interviewing their potential injector to ask those questions like, do you have an ultrasound? How often do you use it? Do you use it pre procedure, or do you just use it in an instance that you have a complication? And so patients will be asking for it. And quite frankly, practices without it will fall behind because patients will realize that this isn't something, it's like going to a tire shop to get your tire fixed. They don't have any tires. So confusing, right? But
Yes.
so practices without it will absolutely fall behind.
Yeah, and it's honestly like this. It's like this is like pre-GPS medicine, versus GPS medicine, right? I mean,
It will get you near the right spot or the right spot every single time. No, absolutely. And once you have it, you can't go back. If you're a patient, ask your injector, if they use ultrasound, if they're certified in ultrasound, and how often that they use it.
Yeah, and if y'all are a provider, I mean, start learning it now. Start learning about it.
Absolutely. Because the future of aesthetics isn't just about artistry anymore, it's about being precise, safe, and also patients need to be holding their providers very accountable.
No, and I think you made a ton of valid, really good points today. Just, yes, I know it's the cost and so forth, but what you end up paying for is for patients that are, like I said, you're working on something you can't see. They might have a negative result, or like we always say too, is like might have that one patient that has a negative experience. Okay, so what do? They tell the world. You
Yep.
have that one patient has a great experience, and they'll tell 3 to 4 of their patients as well. And I think, like I said, we're providing this and the awareness of ultrasound and having this access. I think it's a huge, huge impact to helping not just with filler, but other procedures that you're obviously or other offices are providing for their patients.
That's right. And this concludes this episode of Cowboy and the Queen of Aesthetics because we are here to bring you what is on the forefront of aesthetic medicine and make sure when you're choosing a provider that you choose someone that is all about precision, safety, and accountability. We appreciate you guys joining us today on Cowboy and the Queen of Aesthetics.
And I thank y'all very much. And we cannot wait to hear the feedback, what y'all have to say. Please, like I said, comment, send us messages. We love the feedback. We're loving the feedback we're getting. And we're so excited to continue to do this as we are Cowboy and the Queen of Aesthetics.
Thanks for joining us, and we'll see you next time on the Cowboy and the Queen of Aesthetics.
Thank y'all.